typically it's, you can get a patient should get out of pain after about 6 treatments. If not, then you may, okay, interrupt. I want to hear it.
With our new protocols, we have had patients out of pain within 1 treatment.
Do you think if a patient was going through treatments that you're doing now and had a PRS, would it help them at least keep the pain levels down until their next treatment? Or are you usually suggesting that they get a PRS after their treatments are completely finished?
Once our patients have maintained a 3 out of 10, and we're talking fibromyalgia and CRPS comes in at 7s, 8s, and 9s. And we're talking a lot of medications.
Mm-hmm.
I have one patient. She's very near and dear to my heart. She's been with us for about 6, 7 months, sleeping 15-minute stints before pain would wake her up. And the rheumatologist looked at me and said, "What can you do for her?" And I was like, "We'll figure it out." Now that we've hit that 5, 6 month, she has the PRS again. And it does, if she misses one of her RX treatments, it gets her to the next one. But she is now sleeping a full night and off all medications.
Wow.
Mm-hmm.
So it kind of goes by what you always say, Matt, when you're at pain levels of 6 and above, the RX is going to be the really effective device. And then when you get them to that certain level, the PRS is the way to go.
Them. It 100% maintains them.
Got it.
I have a fibro patient that came to see me for about 4 months, stayed at a 2 or 3. He took off with the PRS, and I keep calling to check on him, and he's like, "Hey, I'm busy. I'm having a good time." I'm like, "Okay, that works." So we're treating everything in there. So even though you came in with the dysfunction in your right glute because your hip was wrong and rotated, we're treating everything lower body. So even though that was your first layer, you may have something going on with your psoas or gastroc, and we're treating it all as one. And since we're treating it all as one, we are seeing patients effectively, efficiently getting better within 5, 6 treatments.
How is this different from the traditional PT that somebody would walk into today that does not have the ARPneuro treatment with, your clinic that has and utilizes ARPneuro?
Well, they're missing the neurological breakdown of the dysfunctions.
Okay.
If a clinic doesn't have this in their tool bag.
You've obviously seen a lot of fibromyalgia patients.
Mm-hmm.
What has been the success rate for you, at least in your 2 offices that you guys have in Jersey?
Our success rate is 100%. I mean, all of our fibro patients feel absolutely wonderful.
You mentioned, fibromyalgia. The other one was CRPS. I mean, these are some really difficult cases. Could you go into any detail on that? Because I know people have asked us about CRPS. I don't know much about it. I haven't treated it, but I have heard that this has been successful for that. So do you have any stories with that you can share?
We have a patient, she has CRPS in her knee from a botched surgery. She's had about 6, 7 treatments now. I'm not personally treating her. I pop in every now and then just to see how it's going. Mm-hmm. Swelling is down. Range of motion is returning. She's made great strides. And the surgery was done 4 or 5 years ago. So she's been really suffering, walking with a cane, struggling to walk. Her movements are more fluid. I would say her leg has gone down 25% swelling.
And that's 7 treatments in the course of what, 3, 4 weeks? Okay.
2 months. Yeah.
A couple times.
A month and a half.
I guess I wanted to go into detail, on top of fibromyalgia and CRPS, some of the other more detailed ones, what have you seen in success outside of what you did with the military, just in your office? What are they coming through for, and what have the results been with that?
I mean, everything from pains like a strain or a sprain to a partially torn labrum, everything. And we have great success around the board. For recovery, because it speeds up recovery time. Okay. Between the blood flow and the circulation, everything going on, it is such an amazing tool. The PRS and their secondary flow. I love having post-surgicals on that because we know we can get them rolling quicker than anything. So if they spent the first few days on the PRS just blood flow stimulation, they can now hit week 2 of their protocols for post-surgical. Their range of motion is better. The swelling is down. The incision site is already healing.
So it essentially makes the surgery almost look more successful in its own way, or heal faster.
Okay, so he looks like almost the surgeon's better off because now you've got patients recovering quickly.
Chronic pains, you don't know how to treat other than throwing opioids and other medications at it. Well, if you have a patient that's allergic to everything, there are no treatments. So for a non-invasive, non-chemically based treatment, it is amazing. And to get it mainstreamed is, God, that is one of my goals. I want to change medical way of thinking and kind of go head to head with Big Pharma on this one.
Oh, wow.